right, when we are testing on the parts of the vertebrae, usually what we'll do is we'll use the loose vertebra that we have here. You can see that they're pulled together in a string, but we oftentimes will separate them for a testing situation. Now this is C1, and this one, of course, is the very bottom, which is L5. You can kind of see some of the structural differences there. But there are some things in common amongst all of the vertebra, and then say grab a thoracic too. Just kind of, let's look at our thoracic vertebra, because this is kind of our typical spinal bone. Okay, so the most anterior part of it is the body, and then the most posterior part of it is called the spine or the spinous process. I want to point that out for you on the articulated skeleton as well. The spine sticks out, and the body, you see, oops, gosh, how do I even view it, is over here in the anterior part. Now the body is going to have this guy here, which is called an intervertebral disc. A slipped disc is how we oftentimes know about the intervertebral disc. When somebody's had an injury to their spine, they might have slipped a disc. Okay. There is a vertebral foramen, and that is the structure through which the spinal cord goes. There are transverse processes on either side. Transverse processes, very good. These articulate with the rib cage, for example. Let's see. The intervertebral foramen, so this here is the vertebral foramen, yes? This hole right here is the vertebral foramen. But for the intervertebral foramina, these are only able to be seen if you look at if you look at them articulated together. You have a place where the spinal nerves can come out and innervate the rest of the body. The peripheral nerves can come out. When we take a look at C1 and C2, the first and second cervical vertebrae, there are some special features. C1 does not have a body. C2 has this extra little protuberance called the dens. Dens meaning tooth-like structure. Over evolutionary time, C1 lost its body and it became attached to C2. So that when you put them together and swivel them, this allows you to shake your head no.